Go ahead. Carolyn got it for me. Thanks, Carolyn. So my name is Allie Orwig. I'm with the Indiana Rural Health Association. Really appreciate everybody coming online today. Got a great presentation for you. Just a couple quick housekeeping items. We are recording today's session in case you have to jump off. We will have it up on our YouTube channel by the end of the week, or if it's a fantastic presentation, feel free to share it with any of your contemporaries, coworkers, etc. We will be taking questions throughout the presentation, which you can use either the Q&A or chat functions. You get to those by hovering your mouse over the screen. Depending on which view mode you're in, they will either pop up at the bottom or the top. If you want to wait till the end of the presentation, you can also use the raise hand function, and we can unmute your line if you want to ask your question verbally. So really appreciate everybody today. Tina was just saying she's an attendee, so she can't talk, but hi to you as well, Emily. And we'll go ahead and I will turn it over to our presenter today, Aib Bryant.
Thanks, Allie. Can you hear me okay? Because my audio just froze up there.
We had just a little blip, but you're fine now.
Okay. Let me know if it becomes a problem. The Wi-Fi here is somewhat touchy, and so if I need to, I can turn off my video in hopes that'll help. But hello, thank you very much for having me. My name is Emily Weikert Bryant. I'm the Executive Director of Feeding Indiana's Hungry. We are the State Association of Feeding America affiliate food banks. We have 11 members that collectively serve all 92 counties. Our 11 members work with about 1,600 after-school programs, mobile pantries, local pantries, senior congregate meal sites, and other distribution mechanisms and organizations around the state. The only thing that I'm really going to show you today is a map of our service areas, so you've got kind of a decent idea of what that looks like. This is at our website, which is feedingindianashungry.org. And you can find the map under Find My Food Bank. And I'll apologize for the backdrop you're seeing here. It's actually lovely aside from the glare. I'm at the State House today. And one of the fun things we have at the State House are phone booths that no longer have phones in them. But folks who are here to advocate tend to hole up in them to do webinars and take phone calls and get work done where it's marginally quieter than it is sitting out in the hallway. So there's going to be people passing behind me, coming and going. So here is our map of our members. So we've got the Food Bank of Northwest Indiana that have Lake and Porter. This is the Food Bank of Northern Indiana. They're located in South Bend. Community Harvest Food Bank is in Fort Wayne. This 16 county area is served by Food Finders Food Bank in Lafayette. This blue region here is Second Harvest of East Central Indiana out of Muncie. The marigold color is actually Gleaner's Food Bank. They have a 21 county service area, and they're located here in Indianapolis. The blue is Catholic Charities Terre Haute Food Bank. Obviously, they're in Terre Haute. The lighter yellow is Hoosier Hills Food Bank, located in Bloomington. The orange is Tri-State Food Bank, located in Evansville. The green here is served by Dare to Care Food Bank, which is in Louisville. And the lighter green here is Free Store Food Bank in Cincinnati, Ohio. So our members work with donors, retailers, producers, and government entities to source food, as well as farmers. Our members distributed, and we measure things in pounds and meals, and so that's where things get kind of different for folks, but we distributed more than 150 million pounds of food in 2021. It was slightly higher in 2020. It was 156 million. That's up from 94 million prior to the pandemic. So there's been an increase in distribution going out, as well as there's really just been a massive influx of federal food over the last couple of years that we're seeing tapering off now. The food that comes from in the federal government is the Emergency Food Assistance Program, TFAP. If you think of it this way, it's sort of the old government cheese program, except it is all the commodities, comes fresh, frozen, shelf stable, many options, but that's a lot of the product that if you were out at a distribution, many of which were mobile in the last couple of years or drive through, that was a lot of the product that we were seeing. I will preface a lot of things with normal times and now, as I'm sure many of you do as well. In normal times, the commodity food really was only about 30% of the food that was being distributed. And the bulk of the food that was coming through our network was coming from either retailer manufacturers. All of our members are Feeding America affiliates. They have relationships with all of your big box grocery stores, as well as producers like Kellogg's and General Mills and other places like that, where product is coming in through either our national partners or is coming in regionally to those food banks. And that's normally what is the larger portion of what's going out through our members to the pantries that they serve. I will again go with, in normal times, really only about 30% of the product that comes through our food banks is going back out directly from the food banks to consumers. Most of that normally goes through pantries. That is a larger variable right now. Our food banks are still operating more than normal mobile pantries, which are generally going to be the drive-through model in places that are either underserved. A pantry doesn't have the capacity to move as much perishable product. We've lost some pantries and partners the last couple of years, somewhere in the network of maybe 100, 200, or things just look different. And so a lot more of that product is coming out directly from our members to clients. The bulk of it is still going out through our partners around the state. So that's kind of who we are and how we operate. Largely the food that we're providing is coming with the understanding that it's for folks who are in need. Unless it's a federal nutrition program, there's not going to be an income requirement. Generally speaking, we say that we seek to serve those who are at or below sort of self-sufficiency, so 200% of federal poverty level. The TFAP product, the emergency food assistance product, is at about 185% of the federal poverty level. We also seek to connect clients with other resources. We know that hunger doesn't exist in a vacuum. If someone's experiencing hunger, they are likely to have issues with housing and utilities and medical bills and transportation and other things. And so many of our food banks work with partners in their communities to help folks enroll for healthcare. One of our food banks actually has an on-site, although this has changed, I think, a little since the pandemic, but part of their on-site pantry, they actually had an on-site health clinic working with St. Vincent. Many of our folks go to distribute food where their partners are in community services to better connect folks to that. We have partnerships with state agencies like the Department of Veterans Affairs, State Department of Health, Family and Social Services Administration, to share information, housing and community development as well, to share information about rental assistance programs, about Medicaid, about WIC, and largely many of our food banks work to enroll in some way our clients in the Supplemental Nutrition Assistance Program, or the SNAP program, formerly called the Food Stamp Program. This is, after this National School Lunch Program, the largest nutrition program in the country. SNAP is why I'm at the State House today. It is why I spend time at the federal level talking to administrators and our members of Congress. We advocate on many things, largely what's impacting our food banks or our clients. So I can tell you, at the State House, if something is impacting nonprofits, it's going to be something we're going to pay attention to. If it's impacting transportation, all of our members have, we have a fleet of, box trucks, vans, semis, trailers to transport product. We deal with the same issues that a rural health organization would, and making sure that we're compliant with county health department, with other inspections and audits. And our members actually go above and beyond. All of our facilities have passed an Aib audit, which is the most particular facility audit for a facility that moves or produces food. So our members are audited every other year for their Aib audit. They're also audited by Feeding America. state agencies, USDA, all of those things. So there's lots of compliance going on. Some of that factors into what we advocate on, as well as really largely access to the SNAP program. So I can tell you there's a few things that I've been working on today at the State House that impact how our food banks are able to operate, how our clients are able to source food for themselves, how that intersects with state legislators, with state administrators, with federal legislators and administrators, to make sure that folks are getting the kind of help that they need, so that they are able to feed their families. So probably the easiest example would be to talk about the SNAP benefits, and some of the eligibility guidelines are set by the federal government, but there's a lot of state options. And so that's what we're seeing legislation on this session that honestly we don't like. And so we're trying to make it die. The easiest way to explain this piece of legislation, it's House Bill 1354, and it would restrict access to SNAP to individuals more so than households. It seeks to do it in two ways. The first is by requiring non-custodial parents to be compliant with a child support order and to be making their payments timely. It would also require everyone who is work eligible, which is very specific terminology. It would be anyone between the ages of 16 and 59 who, and then there's a list of like exceptions, right? So if you're 16 and you're in high school, you're exempt. If you're taking care of a child under 6, you're exempt. If you have a disability, if you are, there's all these factors that you go through. But it would require everyone in that age group to register for SNAP employment and training programs that are designed to provide exactly that: employment and training, application assistance, other things that can be provided through the state to help connect people to jobs. On their face, both of these programs, both of these state options sound fantastic, because we want for people to be connected to child support. We want for people to be connected to the workforce. But the devil's in the details, right? You're familiar with how those programs seem to work. Our biggest concerns are that these two restrictions will prevent many Hoosiers from accessing the SNAP program, who, for many reasons, don't have enough resources to not need the SNAP program. So for the child support piece, we know from other states that very few states are exercising this option. There's 8 or 9, and there's a number of whom who have had it in the past and have backed away from it. It's a carrot and a stick with very little carrot and a lot of stick. So there's many instances where having a child support order on file with a court is not the right option for that family. Domestic violence incidents, incidents of kinship care, where if grandparents are caring for the child and non-custodial parents want to access SNAP, they have to be paying to the grandparents, but there's probably not an order on file because it may be an informal arrangement. Many instances where families don't have a court order, or there's not that garnishing going on from their paycheck, but they have an agreement that they've come up with themselves, or they have a really informal sort of situation where if non-custodial parent just doesn't have the money, but they're able to provide childcare while the custodial parent works, if they're able to provide money when they can, if they are able to provide diapers, different things and different arrangements work for different families. If this bill were to pass as it is, anytime that there's not an order on file that's being complied with, and anytime that a non-custodial parent would miss a child support payment, they wouldn't be eligible. Also works with the assumption that if a person is a non-custodial parent in one situation, that there wouldn't be any children living with them, but we know that's not the case. I could have non-custodial children living with their other parent and then have other children of mine living with me. What this would do would if it were my situation, it would prohibit me from receiving benefits. The rest of the people in my household could receive benefits if we were otherwise eligible, but we would get benefits less me. So you're providing less benefit for the same number of people, which is, an unsustainable way to make sure that we're providing access to people to be able to access the programs. So that's the one piece, and there's, many issues that we have with that. With the workforce participation piece, we see this as a massive financial undertaking that has little results likely to come from that. Research shows that compulsory workforce training programs are not successful. People who are enrolled in the programs tend to do what they need to do to continue to access the benefits, but when it's things like doing a job search, doing a resume workshop, doing things like that, it's not necessarily connecting them to meaningful long-term employment. It's connecting them to the job right now. And it may not be one that provides them enough benefit to sustain themselves anyway. So there's that aspect of it. It's an unsuccessful way to go about connecting people to employment. It's also crazy expensive. Right now, we only have a requirement for able-bodied adults without dependents to participate in the employment and training program. That's 17 to 20,000 Hoosiers on a normal basis. That's currently suspended federally because of the pandemic, but normally we would be spending about $6 million a year for that population in a workforce training program. Expanding this to all work eligible adults would add about 100,000 more people to this program. There's a finite amount of money that the federal government provides across the board, and then everything after that is a 50-50 match. So there's a significant fiscal impact to this that we don't think would bring about any demonstrative change in connecting people to work. So the devil's in the details, right? I'd be happy to talk about other pieces of legislation. Allie, I apologize if I'm not covering what you wanted me to cover. I'm happy to take questions to talk about anything you all would like to talk about. Really, I'm just grateful for the opportunity to be able to speak with you all, to tell you about what our organization does, what our members do, largely what they do, and to figure out better ways that we can work with all of you. All of the areas that you all are serving in Indiana, our members are serving as well. Our food banks are typically located in more urban areas simply because that's where the logistics is. That's where the crossroads are, but we're serving into all of those rural parts of the state. Whether it's, and I grew up in a small town, we got a stoplight after I left. If there's a church on the corner with a pantry, odds are pretty good they're working with our members. If there's not a church on that crossroads with a pantry, then our members are often sending that mobile pantry or other programs out to meet folks where they are. So we're very much serving in the same communities. We're often very much serving the same folks. We estimate that the federal response to the pandemic has prevented a whole lot more Hoosiers from being food insecure or at risk of hunger, but those numbers still persist. They're not getting better. They just haven't gotten worse because of those federal benefits that have been able to sustain families. And that's not just in the food realm, it's the child tax credit, the earned income tax credit, rental assistance, other programs that are coming in to support folks who are low income, who are having difficulty meeting all of those needs. I'm sure you see this just as easily as we do, that there's still a need there. There's going to continue to be a need there. Our folks will always be there. You all will always be there. And so, we'd love to expand our relationships, our partnerships. And with that, Allie, I want to close and take questions to see I know that's very short, I'm sorry. But happy to take questions or if there's any offshoots folks would like for me to explain.
No apologies necessary at all. I mean, the information you provided was very good. So I'll be interested to see if we have any questions come in. Kind of the floor is open now to any of the attendees. As I said, you can use either the Q&A or the chat function to submit your questions, or if you would rather ask verbally, just raise your hand. And that is same place Q&A and chat are. Hover your mouse over the screen, it'll pop down either from the top or the bottom, and we can unmute your line. So we can just leave it open for another couple minutes and see if anything comes in, if that's all right with you, Emily.
Absolutely.
We did get one. You
I
mentioned your
see it.
partners in each area of the state. How do you choose those distribution partners?
So that's something that our food banks do individually. And there's a lot of factors, and it often will depend upon the situation. If it's like I mentioned, and it's a rural area, if there's one church pantry in that area, odds are good that that may be someone that they seek to have as a partner. If there's two pantries at that intersection, often our folks will try to figure out how to get them to work together, or how to work with the one who is able to provide more access. If the organizations, if the pantries are receiving USDA product, there's additional rules and regulations that come with that. There's civil rights training that's required. There's a minimum number of days and hours that they have to be open per month. If they are getting commodity food, there's other things like they can't proselytize and pieces that go along with that. But largely our folks are trying to find partners who have the capacity to move more perishable, healthy food, are located in a geographically underserved area, and are willing to partner. I can say, and this is less a rural issue than an urban issue. I live in Marion County in the city of Indianapolis. There are hundreds of pantries here. And Gleaners is the food bank that serves this area, and they don't work with all of them. They work with very strategic pantry partners, and many of our folks do this in different areas to work with. Maybe it's a multi-service situation where there's other things going on there. Our folks are starting to work more and more with IB Tech campuses and other partners that are kind of part of a larger structure, to have those relationships. But really what we want to do is to make sure that whomever we're working with, clients are able to access them. I always kind of joke about, there's going to be that pantry that's open every third Tuesday, when the moon is waning and the stars are properly aligned and Bob has the day off. There's always kind of those situations where it's a very, very, very narrow window that they're able to serve. And that's okay. Nothing to keep them from doing that. And we certainly encourage them to do so. But that may not be the type of organization that our members seek to partner with, simply because it's not providing enough bandwidth, if that makes sense. Some of our food banks are actively looking for pantry partners in different places. Some of them aren't. If you have folks that in your communities and they're interested in partnering with the regional food bank, always feel free to reach out.
Okay, any other questions?
I'm happy to provide 2 cents worth on federal legislation if that is of interest to the group. I probably should have prefaced with the state association, our job, and it's nearly a royal we, it's me and a half-time person, is to bring our members together, provide them with any additional access to food and funds, support their efforts, build those relationships on the statewide level, like with all of you, and then largely to do public education and advocacy, to explain who our food banks are, what they do, just like we're doing, who our clients are, and what we need to help them, as well as advocating at the state and federal level on programs that impact both our food banks and our clients. I talked about some of the federal nutrition programs. Federally, there's 2 massive pieces of legislation that come around every 5 years that authorize, someone turned on the light next door, sorry, that authorize all of these nutrition programs. The first is the Child Nutrition Reauthorization, which we haven't had in several years. And that's okay, because the programs, as long as they continue to fund them, continue to operate. The Child Nutrition Reauthorization is an opportunity to change the policy. Within that bill would be the National School Lunch Program, the School Breakfast Program, WIC, the Summer Food Service Program, the Child and Adult Care Food Program, and there's a couple of tiny little pieces here and there. There's been talk about reauthorizing or doing another child nutrition reauthorization, and some of the issues that we're looking at that you may see with folks in your community is there's 2 entirely different streams of paperwork to do the child and adult care food system, which would be like an after school program, and the summer food service program. How do we make those programs work better together? How do we increase the reimbursement rate? How do we make sure that kids are able to access it through important programs like the pandemic EBT that we've been seeing during the school year, that connects kids to an EBT card with funding on it. There was a summer EBT last summer. We're trying to get it to continue, because as much as we want for kids to be able to access a congregate site in the summer to eat, we know that's just not always possible. And so the pandemic EBT provides another connection. The other piece that provides structure for the federal nutrition programs is the Farm Bill. So we are gearing up towards a Farm Bill that will be coming in 2023. We're already working with our partners at the Indiana Farm Bureau. My office is inside the Indiana Pork Producers Association. They're my landlord, and a building owned by the Corn and Soybean Association with the beef cattlemen down the hall, and the dairy associations now right across the hall. We work with them because they're the ones who produce the food. The Farm Bill includes largely SNAP and TFAP. Those are kind of and the Commodity Supplemental Food Program, which is a senior box program. It's where we talk about the policy. It's where we talk about the funding levels. Some of that is adjusted on an annual basis, but largely the formulas for that go into the Farm Bill. And so we're working to make sure that the access to the SNAP program doesn't change significantly, that the funding for the Emergency Food Assistance Program, or at least the formula for it, is consistent. We are currently asking for another $900 million in TFAP funding, because once the pandemic funding stopped, there was kind of a large drop. But also, making sure that there's funding that goes with that enables our folks to keep the lights on, keep the trucks moving, keep them gassed up. They call it administration. We call it storage and distribution, because the food does not move itself. It does not cool itself. And so those are things that we factor into the cost of doing business. The federal funding provides maybe half the cost for that actual food to be stored and distributed. And our folks just privately raise for the rest of that, because it's the best product that we get. It's purchased for us through the USDA, distributed directly to our members, and goes out directly to the organizations and the clients that they work with. Healthy, nutritious product, again, coming from America's farmers. And it's a great program. So those are kind of the two pieces that we work with at the federal level. And both of those are sort of kind of in conversations right now. And so we're trying to figure out, how do we adapt what we're doing? What do we want to see with those two pieces of legislation? What do we not want to see? And how do we want to try to continue what has worked with the pandemic response programs, like the pandemic EBT? We're looking at the SNAP emergency allotments right now at the State House, because those are connected to a federal public health emergency and a state public health emergency. I testified on a bill on that this morning. There's moving pieces, but a lot of it is pretty detailed, as is healthcare. I don't even pretend to understand a lot of aspects of what goes on in healthcare, because it's just so into the weeds. So hopefully there's another perspective there.
Yeah, very helpful. And like I said, very good information, I think, for people to keep in mind. And also, how all the moving pieces affect each other. I think it's important to remember, as you said, there's so much federal funding that came out for other things that don't sound like food insecurity dollars, but end up being very helpful, like student loan pauses on paying, for rental properties or whatever, child tax credits. It doesn't immediately sound like funding for food insecure individuals, but it all ties together. So, yeah, as Paula commented, super interesting and complex. Agreed, Paula. Agreed.
Yeah, and the child tax credit's a perfect example. When those payments stopped coming in January, I'm waiting to hear from my folks that there was a tick up in clients. But we've got data that shows that even in Indiana, the child tax credits that came last year were largely spent on educational expenses, food, and basics. We know folks were continuing to use that funding too to supply food for their families because it was available. And it enabled them to access things they need, put the money to what they needed. And, for many families, a good chunk of them, what they still needed were those necessities.
Okay.
I feel as though I've overwhelmed everybody with.
I think that you've covered all the questions we had. You certainly covered everything that I would have asked you about. It was a lot of information, but as I said, today's session is recorded. So if anybody needs to go back and check it out, if people want to reach out to you, Emily, is there a good way for them to do that?
Yeah, I'm happy to put my email in the chat. It's just EW Bryant, Bryant, at feedingindianashungry.org. Be happy to answer questions, things that come up in your communities, connect you to our partners that are out there, and making those connections. Hunger is health, health is hunger. We're well aware of this.
Well, thank you so much for your time, everybody. Great session. Happy to have you with us and hope you enjoy the rest of your day. Thank you.
Thank you.